My feet are numb. They tingle, they burn. They seem to be much worse at night. What do I do? Peripheral neuropathy is one of the most common things I see in my practice because my practice is very much a neurodiagnostic practice. I probably see, 5 to 20 cases a day. Peripheral neuropathy is really distressing. Number one cause of peripheral neuropathy is diabetes mellitus. Number two is alcoholism. When I was younger, they told us that 95% of people with neuropathy are diabetics or alcoholics. It's not that high, but it's a large percentage of people. So what kind of symptoms do they have? They have numbness, burning, tingling, sharp shooting, lancinating pain in their feet. Burning can be most prominent, sharp shooting, lancinating can be most prominent, and they have numbness in a stocking glove distribution. So if you imagine gloves, it'd be numbness under my gloves, numbness under my crew socks. So a stocking glove distribution, very sensitive to touch. Many people sleep with their feet out from under the covers. As it progresses, there can be a lack of coordination and falling. We see this very common. People come in with neuropathy, but they come in because their balance is bad. When it gets really severe, their muscles can be weak. They even have a foot drop. Very heat intolerant, altered sweating. When it gets severe, bowel and bladder problems and digestive problems. So we do sort of the Peter Dick Mayo Clinic workup, 7 tubes of blood to check for diabetes, thyroid disease, vitamin B12, vitamin D, vitamin B1, B6, vitamin E, paraproteins. We commonly see monoclonal gammopathies where the serum immunoelectrophoresis shows an IgG or a kappa or lambda chain. It's a precursor to multiple myeloma, so we send all of these patients to oncologists to be followed for a minimum of 5 years. You see it in paraneoplastic syndromes, people have cancer. You can see it from chemotherapy. You can see it from vasculitis, which is an inflammation of the arteries. You can see it from renal failure. You can see it from liver failure. Many medications cause it. We used to use Dilantin a lot for seizures, and it would cause neuropathy. We see every day patients on chemotherapy have neuropathy. Infections like Lyme's disease, Epstein-Barr, hepatitis C, HIV, very common in HIV. Bariatric surgery, sometimes I wonder if this is from the rapid weight loss, what we call a slimmer's paralysis. And a strong family history of neuropathy is common. So what's the workup? Nerve conduction EMG studies to check to see what type of neuropathy it is. We can go into this more later. And then blood tests, the 7 tubes of blood, the Peter Dick Mayo Clinic workup. CBC chemistry profile, thyroid screen, all the vitamins I mentioned, B1, B2, B12, vitamin D, a serum immunoelectrophoresis, a SED rate, and CRP. Paraneoplastic antibody panel in some cases, hepatitis panel if the liver function is abnormal. Sometimes you have to check an ANA and RE factor if you're concerned about accompanying rheumatological diseases. And then if it has sort of a demyelinating picture on the nerve conduction, and we'll talk about this on another video, a lumbar puncture to check the CSF protein to see if there's any chance that we could treat them with IVIGG. So that's neuropathy. If you have numbness and tingling in your feet, see your family doctor and then have him refer you to a neurologist experienced in working up neuropathy. And this is Dr. Caudle Miller, the brain doctor. Like, comment, subscribe. I'll answer your comments within 1 to 3 days every time if you have any questions.